The definition of global health is that it's an area of study, research, and practice that places a priority on improving health and achieving equity in health for all people worldwide. It emphasizes transnational health issues, determinants, and solutions, and involves many disciplines within and beyond the health sciences and promotes interdisciplinary collaboration. It's a synthesis of population-based prevention with individual-level clinical care. When you're studying global health, you're going to gain an in-depth understanding of factors related to illness, health, and healing from an interdisciplinary perspective that transcends national borders and regional interests while taking cultural difference and diversity fully into account. So when we look at health, we're not looking at health in the US, health in Africa, we're looking at the health of the whole globe. And one thing we want to emphasize is that the US is also part of the globe. Some of the topics that you'll cover in global health will be from healthcare, health education, environmental effects on health, infectious diseases, reproductive health, mental health, health inequities, medical sequelae of natural disasters and political violence. So the aftermath of when there's a political disruption or if there's a natural disaster that occurs, how it affects healthcare outcomes and the reality of what that leaves people in, and some indigenous healing practices. So you're going to be able to specialize with your electives even more so, where if you have an interest for a certain topic, some of your intro courses will go briefly into each of these, and then you can decide which topics are most interesting to you. Academic advising and major requirements. So at UC San Diego, there's 2 sets of academic advisors that you're going to be meeting with. You're going to meet with your college advisors. They're going to help you with your GE planning. They're going to help you with any petitions related to your GE or university requirements. And they're also going to be the ones that you'll go to for university policies. So if you're having issues with transcripts or you have a general question about your education, then you're going to go to your college advisor. When it comes to your major advisor, you're going to come to us to work on your planning for your major requirements. And also, if you're going to be petitioning any courses for your global health major, you would come through us. And then anything with your field experience requirement, or if you're going to do a special studies course, so independent research with a faculty member, that could be something that you would do through your department. So to get a hold of your global health advisors, we have a couple different ways to do that. You can send us a message in the VAC, which is the Virtual Advising Center. You'll have access to this once you begin to enroll in classes next week. And right now, some of you are using the eVac to communicate with us, which is great. We also have walk-in advising hours, weeks 1 through 10, that you could come in and get advising and work on planning and ask us any questions. Right now, those are Tuesday, Wednesday, and Thursday from 8:30 to 11:30. Or you can make an appointment by contacting us at ghpadvising@ucsd.edu. And you'll want to include your name, your PID, the reason you want to meet, and 3 appointment times that work for you. We don't schedule appointments during walk-in advising hours. There are many other resources besides advisors that you can utilize to kind of stay connected through global health. We have 2 Facebook pages, one for general to share events, scholarships, opportunities, and then we also have a field experience Facebook page as well, so you'll get access to all those links. We use Twitter, we use email, we have a Pinterest page, and we use a blog and post a lot of spotlights and provide opportunities through there as well. We'll take a look at those shortly. Let's dive right into the major requirements, as I know a lot of you are anxious to begin planning out your courses for fall and beyond. The Global Health major requires 17 courses, all which are 4 units, so that's 68 units total. And all courses must be taken for a letter grade of C- or better, so you do not want to take any of your major courses for a pass, no pass. Your college may have classes that you're allowed to do for a pass, no pass, so that's something you'd want to check in with them or check their website. And your global health field experience must be completed by the end of fall of your graduating year. That means you're going to enroll in a senior capstone during your senior year in winter and spring. So by the time you start that, you need to be done with your field experience requirement. There are a couple lower division requirements for global health, and that is an introduction course. So there's the introduction to global health or the history of public health. Both have various options throughout the year. We'll take a lower division sociology related course. So a lot of students will say, oh, I took a sociology course at community college. Does that count? This would actually need to specifically be a health sociology course. Or you could choose to take the Introduction to Global Health if you didn't use that for your introduction course. We also have a stats requirement. So we have a few options here of stats that you can take. And if you received a 3 or higher in AP stats, you can use that to fulfill that requirement. If it's not automatically counting on your degree audit or given a UCSD equivalent, you can submit a petition to our department. And all of our course descriptions can be found online on the courses page. Can we please, there's a few, it sounds like a few are not muted. If you wouldn't mind muting. Thank you. Okay. So now we're going to look at the upper division core. So you'll be taking Global Health 148, Global Health and Cultural Diversity. This is a cross-listed course with ANSC 148. So some of you have noticed that in fall that Global Health 148 is already filled up. There's actually the same section of it offered as ANSC 148, and there's still room in that. So you're welcome to also enroll in that as well, and you'll still receive the same credit. Global Health 181, Essentials of Global Health, is a course taught by faculty in the School of Medicine. So 148 is usually taught by an anthropologist, a medical anthropologist. And then MGT 173, Project Management in the Health Services. This is taught through the Rady School of Management. So you're really going to get the three-pronged approach to looking at things from a medical standpoint, from an anthropological standpoint, and then also from a business aspect. And even if you're not interested in business, it's really, valuable to know how the inner workings of healthcare works. And then we also have a policy analysis course required. And as I mentioned, during your senior year, you're going to take a capstone course. It's 2 quarters. We'll take part A in winter and part B in spring. So when you're working on your 2 or 4 year plan or 3 year plan, you'll just plot that in automatically during your senior year. And then for your elective requirements, you have 3 bio courses. 1 must be upper division. You'll have 3 medical social science electives, and these are all upper divisions. These are courses that look at social and cultural context and economic and political factors of health. And then you'll have a medical humanities elective, which is upper division as well. And this is looking at either medical history or bioethics or literature on health. And then you'll have a global processes elective. So this will be something on immigration or climate change, globalization or development. And then, of course, as we mentioned, there's the 100-hour requirement for the field experience, and we're going to go into that a little deeper in a few slides here. So some tip from a former global health student is that when you're choosing your electives, use this as your chance to take courses that influence your path of study. If there's a global health topic you want to specialize in, take electives that cover that interest. They can help you find out what you are passionate about. So as I mentioned, there's a couple courses that you can get covered from previous coursework, either at community college or if you've transferred from another school or you've taken AP courses. So if you're transferring from a community college, all of your coursework is counting as lower division. So there's only a couple of global health courses that are lower division that you could actually satisfy before coming here. So that would be the stats requirement and up to 2 biology courses. So say you took physiology at Mira Costa College, that would be something that could be applied to a global health major. So you'll see that on your academic history, if you look at that,
that's me right now, my brain.
Do you mind muting? Yeah. Sorry about that. Okay, so you'll see that there's a UCSD approximation already assigned on your academic history. So if you took ecology and environmental biology, that was already equivalent to UCSD's Build 18 course. And then if you took stats and it's already been articulated to a UCSD course, it'll automatically show up. If not, you can submit a petition So if you're on the Global Health website, you would go to petitions and forms, and then you would submit an online course petition. So say you took stats, but it's not automatically counting already for Global Health. You would submit the petition here and include the syllabus, and then our program director reviews your request, and we will get that handled for you. Okay, so many of you have a lot of questions about the Global Health field experience requirement. So the Global Health field experience is really designed to make you more knowledgeable about aspects of global health and really see global health issues in practice. So this can be completed by doing an internship or research opportunity, volunteer, study abroad, or finding your own opportunity. So we have a list of pre-approved opportunities on our website, but you're also welcome to find opportunities that really speak to you and get those pre-approved as well. It just needs to be 100 hours total. You can have actually up to 3 experiences total to get those 100 hours. So each experience doesn't have to be 100 hours, but to complete the requirement, you need 100 hours. So if you're working domestically, this needs to be over at least a 5-week period. If you are going abroad, you could actually complete this in 3 weeks because you'll be more saturated in the experience. So it can be domestic or international. It could be right here in San Diego, or if you have a desire to work in Mexico or go study abroad, that's one way to do that. It doesn't have to be credit bearing. The placement must be pre-approved, and you must review all of the health and safety information prior to beginning at the site. And as I mentioned, you can create your own field experience as well. So quick facts on field experience. You must complete it prior to beginning your senior capstone. You can participate in a maximum of 3 experiences, and they must last at least 5 weeks combined, or for international experiences, a minimum of 3 weeks. So the steps to starting to find your field experience are to step 1, research the field experience options on our pre-approved list. Aside from our pre-approved list, you can attend events on campus, network. We send out a monthly and a weekly newsletter with many opportunities, and follow us on Facebook to look for opportunities as well. So if you go on the Global Health website and you click on Field Experience Pre-Approved Opportunities, we have a document here with all of our local opportunities that you can look through. So we have special programs, we have local organizations to work with, anything from Asian, refugee, research centers. And then if you scroll down, we have a list of pre-approved international experiences. So as I mentioned with Study Abroad, they have UCEAP, and they have programs that have built-in field experiences. So for example, in Botswana, they have a community public health track, and you work in a local health clinic. So that's just one example if you want to start researching ideas. As I said, I know this can be pretty overwhelming to find your field experience, and don't think that you need to find it right now. We send out a lot of information, and there's opportunities throughout the year for you to learn more about this. So you can start thinking about what you would like to do, and then be open-minded to opportunities that you're going to continue to hear about. So if you don't see something that fits and you're not seeing anything in our newsletters or anything on campus, you can seek out your own field experience. And on the website, there's a link here that says Field Experience Pre-Approval Request. So this is where you would input all of the information to request pre-approval. And once you've identified a program or an opportunity, you will contact the organization directly and see if they have availability for you to get started. So the field experience is up to you to get started. We don't initiate it for you. We just have the pre-approved program, so you'll have to take the initiative. And you'll want to sound professional in your contact as well. Don't just write, hi, I want to work there. What do you have available? Present yourself well. And then while you're on site, you're going to want to keep a log of your hours. So there's a couple places where you'll see the log here. And then, so you would log your hours here, and then you would have your supervisor sign off on this. Once you've have this signed off on, you would submit the hours to GHP Advising or bring into the advising office, and that's how you would get your hours verified. There's more information here under Submit Verification about getting your field experience hours completed. And of course, you'll review the health and safety information page and submit your hours signed by your supervisor. So how do you find a field experience? Networking is very valuable. Follow us on Facebook. Talk to your professors. Sometimes they share opportunities in class. They'll share research in their own labs. You can explore, there's a research internship portal, real.ucsd.edu, and you could go through our blog and see what other field experience students have completed as well. So here's the form we discussed about creating your own field experience and the log. And in terms of health and safety, there's just a few things I want to emphasize so that you can have the right expectations about the field experience requirement. You're not there to be providing direct patient care and testing, diagnosing, or treating patients. You're really there to observe and learn. It's not safe for students to be actually participating in healthcare administration with patients. So there are times when you could help with taking vitals and blood pressure and that, but we don't want students in there performing, labor and delivery and C-sections and surgeries. That's not something you're going to do during your field experience. And that's something you really need to understand before going into these opportunities, is that knowing your limitations of what you can and cannot do. And understanding that when you're on site, you're representing UC San Diego and you really need to be on your best behavior. It's important that you maintain confidentiality of the patients that you're working with and following the rules of the site and your supervisor, and don't overstep your boundaries. Just see what your supervisor and yourself are comfortable with allowing. So we have the senior capstone, the 2-quarter sequence during your winter and spring of senior year. And during the first quarter, it's going to be an intensive reading and discussion in fields related to your primary interest in health. For many of you, this will be building on your field experience, but if you didn't have a great field experience, which is okay, you don't have to write about your field experience in your thesis. So really, the field experience is designed so that you can really find out what you enjoy. And sometimes students walk away, they think they want to go into research, they work in a lab, and they realize this is not the path that I want to be taking. And that's great, because it's better to find it out now than after 8 years of education realizing that. During the second quarter, it's going to be workshopping with critical input from your classmates, and it will focus on preparing a research poster and your thesis. So you're going to be guided each week with your draft, creating an outline, bibliography, gathering sources. So this isn't something you need to be worried about before entering into the capstone. It's just something that you will be aware of that you will be completing during your senior year. And it really gives you an opportunity to expand, deepen, and share insights from your field experience or the topic that you're really passionate about in global health. And this is really helpful if you're applying for any master's or medical school or anything post-UCSD. It kind of gives you this credential showing that you can blend sciences and the arts and humanities together to communicate results. And that's something that a lot of, programs like to see in students, is that they can not only understand material, but also communicate it effectively, especially if you're planning on going to medical school. And then you'll present your research poster at the Horizons Research Symposium in spring quarter. So I'd recommend that everyone attends that every year to see how other students have completed their research and field experience as well. So, and by present, that means you'll stand by your poster and answer questions as people come by. So just a couple sample topics from senior theses. We have health barriers and morbidity of Afghan refugees, a call to support male survivors of sexual assault, cultural competency of drug rehabilitation programs for Native populations in the U.S., mobilizing for women's rights, birth abuse and disrespect is a global phenomenon, So you can see it's very diverse, and if you're interested in looking at more abstracts, they can be found online on the Horizons page. That's under the Events tab. And we'll be sending out this presentation, so you'll have access to these links as well. Some of you may be interested in your time in doing independent research with a faculty member. You can do up to 2 of these during your time here. So it's important to really help, if you're interested in this, develop relationships with faculty in class, or if you get a research position, this is something you could discuss with the faculty member. So creating a course where you're going to receive credit, just know that by setting up this as a course, so you don't have to receive credit if you're working in a lab or research. But if you would like to turn this into course credit, you can. You'll be required to submit a 10 to 15 page research paper at the conclusion. So there's links on the website to learning more about independent research. I would look into this after you've been at UCSD at least for a quarter, so that you can kind of gauge what type of opportunities there are. And Emma, who's a global health alumni, recommends that if you're interested in a topic or in working somewhere, send your resume to the professor studying that topic. Put yourself out there. It can only benefit you. And Emma ended up having many research opportunities during her time at UCSD. She worked at the Center on Global on Gender and Women's Health, and she's now attending Emory University to receive her master's in global health. So if you're looking for research opportunities, you can use the REAL portal. It's real.ucsd.edu. Career Services also has a program called Handshake, where you can find internships, and there's also InternLink. You can also reach out to faculty and inquire if they have opportunities. We also, in the Global Health newsletter, share research opportunities that we hear about. Often faculty will contact us and say, do you have any global health students who would be interested? And we send that out to you guys. So make sure to read those emails. And of course, word of mouth. So maybe you have a friend who's working in a lab, or you're in a student org and you hear from someone else, and that's another way to get involved. Some other common questions we've had in our poll was, some of you are interested in double majoring, and double majoring is definitely possible to complete with proper planning. So you can typically, well, you can overlap all lower division coursework at UCSD, and with a double major, you can often overlap 2 upper division courses. So you just have to have 10 unique upper division courses per major. So for global health, you at least take 12 upper division courses, so that's how you can have those 2 upper division. This is something that you can't submit until you're junior standing, so you'd have to have 90 units to be junior standing, and you have to submit it before you reach 135 units. And you want to complete as many lower division requirements for both majors before submitting for a better chance of getting approved. So if you're interested in a double major, I would meet with both departments early on to start planning that out, and then you could submit the as soon as you're eligible, you can submit that petition. So some compatible majors, if you're trying to be the most efficient with global health, are any major that has an overlapping course. So the global health curriculum is very diverse. You'll be taking courses from biology and sociology and anthropology and economics, or however you plan out your electives. So those are going to be departments that would be very compatible with double majoring, or psychology, for instance, so that you could utilize those overlaps. Global health also has room in it where you can add a minor on pretty easily, and with minors, it's usually 5 upper division courses, and 2 of them can overlap between your major and your minor. So if you choose the right minor, such as anthropology, you would only have to take 3 upper division courses and 2 lower division courses. So you can also overlap all the lower division coursework. So that's something that you'd want to plan out as well. So many of our global health students will minor in anthropology, biology, urban studies, psychology, business. And you don't need to choose a minor right away. It's probably something you want to start seeing what really interests you along the way. So taking classes for your major and then deciding what would be a good emphasis down the road. When it it comes to tracking your coursework, we have a couple different ways that you can do that. There's an undergraduate degree check on our website, and it's been sent out to you. And this is really the best way to be marking your progress off for your major and working on your 2-year plan. And one thing to note, so lower division courses are courses with the numbering of 0 to 99, and upper division courses are 100 to 199. So as you can see, so you could plot out your HILD 30 and Global Health 20, so you'll check that off once you've completed it, mark it in here for your planning. And then you also have a degree audit. So in your degree audit, you can actually see which of your transfer or AP coursework is already counting towards your major requirements. So the first column of your degree audit is going to be your major requirements. So here's a little snapshot. So if a category is still in red, that means you haven't completed that full requirement. If it's in blue, it means you've completed that. So over here in the right, you can see that for the lower division stats course, it's in blue. So this student has already completed stats with their community college course. So their community college course, it articulated or was approximated to UCSD's Psych 60, which is our stats course. So you can see if your transfer course, so it usually has that T next to it and then the grade. That means it's a transfer course. So for the biological sciences, so this student coming in as a transfer student completed the most possible transfer coursework towards the major as possible. So 2 lower division biology courses and the stats requirement. So check your degree audit and see what's already automatically counting for your global health major. And then as you enroll in each class, it should populate under the correct requirement, and you can track your progress this way as well. So I'd recommend using the degree check and your degree audit to kind of be keeping track of your coursework. And the field experience requirement is going to show red until you submit your letter of verification. When it comes to selecting your courses, we send out every quarter the current upcoming course offerings, and we also have a tentative annual course offerings online. So Ashley Yumika, who's an alumni, says, global health is so expansive. Try everything from psychology classes to anthropology to literature classes. Be a Renaissance scholar and know a little bit about everything. And that's great advice. So let me pull up our page here. So if you go onto the Global Health website here and you click on courses, you can see here that we have these documents here. So you'll be looking at fall to plan out your fall courses, or you can look at the annual schedule. And also for those core courses like Global Health 20 or Global Health 148, then this is where you can see those core course offerings. So there's plenty of electives offered every quarter. You just want to make sure you're getting those core courses in as well. So for Global Health 20, that's offered in fall. If that's filled up, plan to take it in winter or spring. So if you're a freshman or you're not completely upper division standing right now, the lower division courses are really the only ones you'll be able to enroll in right now for the core. And then for our upper division, Global Health 148, it'll be offered every quarter. So if it's filled up in fall, plan to do it in winter or spring. MGT 173 is also offered every quarter, and Global Health 181 is offered in fall and spring. We also have some of our own department Global Health electives, and those are just a few of what you can take, but if you look at the annual schedule, you don't have to just take them from Global Health. There's many ways to do. If you have more interest in psychology, or you can kind of diversify that. So if you go through this list, you could see all the biological science courses offered this year. So there's course offerings every quarter. And then you'll go down, you'll see the medical social science electives. So if you're interested, for instance, in immigrant and refugee health, that course will be offered in winter. So you can scroll through each category and kind of plan out your courses. What I recommend when you're working on your plan, though, is have a backup plan and also be flexible. So if you've downloaded the undergraduate degree check here and say you're a freshman and say you're a transfer and you're planning to complete your courses this year, so maybe you're going to take global health elective in fall, and you're going to take global health 20 in winter, and global health core in spring. So the core is the 148 or the 181 or the 173. So kind of just plan it out for your future courses a little more flexible. So then you would put the global health 150A in winter and global health 150B in spring. And so if you count your electives, so you have policy analysis, and then you have 9 electives here, so you can kind of say 1, 2, 3, 4, 5, 6, 7, 8, 9. So if you planned out in a 2-year plan, this is just kind of a sample of how you can kind of, if you've already completed stats and you need, your sociology course here. So let's see if we move this down. So you could do Soc course, Soci lower division. So this is just a helpful tool you can use to kind of map out tentatively your courses here. And of course, you'll have college GEs unless you are completely satisfied those at community college. And then if you're a freshman, you're going to be more taking your GEs for the first 2 years. You can take some lower division courses for global health, but you're going to be mostly focusing on those upper divisions in your junior and senior year. So you will want to take mostly your GEs for your first year. And then if you can fit in your major requirements, but it's not necessary. So I kind of just showed you a little sample plan, and we have sample 2- and 4-year plans available on the Global Health major page. And here's kind of a flexible plan as well. So this would be if you're a freshman, you can start these lower division requirements earlier, but it's good to knock out some of those writing courses. And then you'll want to make sure you complete all of your global health core courses early on, so don't save those to the last 2 quarters. Because they're going to help you write your senior thesis. And I saw someone asked how long is a senior thesis. So it's around 10,000 words, so anywhere between 30 to 40 pages, double space. Don't let that intimidate you, because it is a gradual process that you're led through. And have many elective choices ready when you're registering, because they can change without notice, and they can fill up. So just kind of keep that in mind. So here's a sample plan. If you're entering this year, you could take your stats in fall, global health 181, and a global health elective in fall. And if you have college GEs, you're going to want to add those in. And you can I would recommend getting most of the core done during your first year. So if you're an incoming transfer student or freshman, I would highly recommend starting with 3 classes. Just to get used to UCSD and the quarter system. Things move very quickly, and you don't want to sabotage yourself early on. If you have problems with your transcripts not showing up right, you'll want to contact the admissions office. So you don't want to write to your major and ask, why is this not showing up? You do need to contact admissions, because they're the one who really handles that portion of your transcript. I know we have many pre-med or pre-health students in the house, and many of our global health students are. We've sent out an email that has some resources for enrolling in courses, so it'll go more into detail for you to help plan out your courses, and also on pre-med planning. Just to quickly go over it, because this doesn't apply to everyone, so I'm going to keep it a little vague. But again, I said that PowerPoint presentation that was sent out will be very valuable, and we'll have additional resources for you. So pre-med means that you're planning to apply for medical school to become a doctor. This will require you to complete prerequisite requirements to apply. So when someone says they're pre-med, it doesn't mean they're any certain major. You could be pre-med with any major. It means that you're completing prereqs to apply to med school. If you're applying to a different type of health-related school, so nursing, dentistry, optometry, even a master's in global health or public health. This is considered pre-health, and there's going to be different courses that are required for those. So on our the major page for the global health website, let's take a look here. If you click on major requirements and you go to the very bottom, there are resources on pre-health and pre-med requirements. And we also have HealthBeat, which is actually the pre-med advisors and pre-health advisors at UC San Diego. So there's someone that you can use as a resource. Whenever you do any pre-med planning with, for instance, like your major, you're always going to want to check on everything with HealthBeat as well, and with the specific schools that you're interested in applying to, because every school has their own unique requirements. So these are kind of just general recommendations. And let's see. So you're definitely able to incorporate some of the pre-med or pre-health courses into your global health requirements. So for instance, some of the biological science courses, or SOCI 70, which is sociology for pre-meds, that prepares you for the MCAT, but you are going to have additional courses. And the major is designed so that there is room to build those courses in. So like I said, you want to check out the pre-med requirements on the major page, and you're going to want to visit HealthBeat at Career Services early on to discuss planning. They host a few workshops during fall quarter, so when you receive your first Global Health newsletter, you're going to get all this information about the upcoming workshops, and they have drop-in hours during fall quarter as well. They also have a newsletter that they send out weekly, so if you're interested in the health field, I would join their newsletter as well, and attend all the events that they have on campus and webinars and network. That's really going to be your most valuable resource. And UCSD really does cater to pre-med and pre-health students, so there are a lot of resources for you here, and don't feel that you need to understand everything from day one. So just quickly, the general pre-health required courses are a year of biology and lab, a year of general chemistry and lab, a year of organic chemistry in a lab, a year of physics in a lab, a year of calculus, a quarter of statistics, which you'll complete with your major, and a year of English, which you'll most likely complete with your college requirements. And then in addition to that, some programs will actually require you to have biochemistry, sociology, psychology, genetics, cell bio, anatomy, and physiology. So if you're not planning to apply to medical school, you'll have a little less requirements than that. Than this, like for instance, you won't have to take physics. So not only do you have the pre-med requirements, but you also should be completing extracurricular requirements. So the field experience kind of overlaps with that. You'll want to be volunteering in clinical hours at hospitals, and you'll be studying for the MCAT exam, and a lot of students will do a gap year to prepare for that, and you'll also want to get research opportunities at UCSD. Okay, so now that we've covered some pre-med and some global health requirements, let's talk a little bit more about what some of our students do for the global health field experience requirement. So we do have some special programs in global health that you can participate in, and you'll hear about these opportunities through Facebook and the newsletter, so keep a lookout for application deadlines. One of our most popular ones is HFIT. It's Health Frontiers in Tijuana, and it's a class where you go work at a clinic at the border with faculty from the School of Medicine on Saturdays, and you have a class associated with it. And this is a really good experience if you're interested in working with diverse populations or going the pre-med route. So 2 quarters of participation in this equals 100 hours of your field experience requirement. Plus you can enroll in the course, so it would actually fulfill your medical social science elective. So they have quarterly application deadlines. So the deadline for fall is already passed. However, we'll be sending out details about the opportunities for winter, spring, and sometimes they have summer opportunities as well. There's something that gets sent out about the Blum Cross-Border Initiative opportunity in spring quarter, and this is actually a paid internship. You get $3,000, and they select 2 global health students each year. It's an 8-week internship, and you will conduct field work, in teams and address issues such as poverty and social equity in San Diego and Tijuana at the border region there. So, and you'll get to specialize more in what type of topics that you're going to pursue. There's also the Life Scholars Program, and this is something that you would receive course credit for as well. So some experiences will be completely volunteer, some will be associated with courses. So you can kind of choose how you want to complete that. And this is where students work with elders of diverse backgrounds and explore the factors of aging and how that affects health outcomes. You will write a paper on healthy aging, and you'll be working with faculty at a research site as well. So this would be 2 courses that you would take in winter and spring. So you'll hear about the applications call for that likely in fall quarter. Now, those are just a couple examples. If you go back to the field experience page on the website and you look at these pre-approved opportunities here and you go down to special programs, there are other ones such as UCDC, where you can learn about health policy in Washington, D.C. There's Community Health Associates, so that's something that applications get sent at fall and you're placed at a site in a health internship, and Student Health Advocates. So those, as I said, there's many opportunities. There's also study abroad programs like CFHI, and this is non-credit bearing study abroad. It's more just a field placement, and there you have opportunities in over 10 countries and focusing on different topics in global health. So anything from maternal and child health to AIDS and HIV, and you name it. The Flying Sands is also a student organization at UCSD, and they run their own clinic near Ensenada. So if you're interested again in working at a clinic, getting involved with the Flying Sands is a great opportunity. There's also alternative breaks. So these are UCSD organized programs that run during spring break and sometimes during winter break. And each year they have different sites that you can sign up for, and these will address issues in global health as well. So now on to study abroad. So Venice is a UCSD alumni who says, step out of your comfort zone, embrace ambiguity. I never would have imagined myself living in an isolated village in the mountains, showering with a bucket and eating farm wraps. So here's what you need to know about study abroad. You should start researching and planning 10 to 14 months prior to departure. So if you're interested in going in summer of your first year, you're going to want to start getting things lined up in fall quarter. And most deadlines for summer and the following fall are around March or April. Some of them have rolling deadlines, but that's just a common deadline. And there is a pre-approval form, so you will, on the field experience and on our study abroad page, we do have pre-approved programs. But if something, so we've already pre-approved courses for some programs, but if you are planning to do coursework, you're going to apply for your major, you can submit a pre-approval form online. And that way, before you go on study abroad, then you're going to have that guarantee that that coursework is going to come back and count for your major. And when you return, you'll submit a petition once it's on your academic record to actually get that to count. So you can take a maximum of 6 courses for study abroad to count towards your global health major. So we really do want you to go out there and get that international experience, because you are a global health major after all. So there's many different programs you can participate in. So there's EAP, which is Education Abroad Program, and that's recognized as UC credit, transferring back to UCSD, and you could study abroad at thousands of universities that we already have basically agreements with. Then there's Opportunities Abroad, OAP. So that's for global health, there's a lot of OAP programs, and they're really designed. So SIT Study Abroad is one example. They have very specialized global health programs for students with course credit. So for instance, public health and urban environments in Argentina. They have India, public health, policy advocacy and community program in Chile, Brazil, Jordan. And then we also have what's called global seminars, and these are opportunities that are 5 weeks during the summer with a UCSD faculty member, and you receive two course credits for this, and it's usually with a pretty small group of 15 to 28, and you get to work one-on-one with a UCSD professor. So every year these options change. This year right now we have students who are in Thailand studying global health. The previous year we had a program in India, we've had programs in Amman, Jordan. So there are some options this year, but they don't cover the field experience requirement, which is fine. You can still just go for course credit. They are the psychopharmacology in Florence, origins of the mind in Scotland, and social cognition and drugs in Australia. So these ones, you can look at, if you go to the study abroad page, you can see which courses they'll get pre-approved for, but they're probably going to be more like biological science or medical social science electives. If you're trying to knock out study abroad and field experience, you probably want to wait for another year of an opportunity to come up. Let me real quick show you a little more study abroad before we move on. So if you go onto the Global Health website for study abroad and you go down, you can see some of the courses that have already been pre-approved for other global health students. The program, so it's UCEAP. There's a program in Thailand in Thammasat University that's very popular. They have a summer program that looks at mobility and border health and health realities in border populations. So that's just an example. And then with the global seminars, you can see which ones. So for instance, there was this social cognition course here. You can see that these fulfill a biological science and a medical social science elective. So these are just some here. We promote more in our newsletter, and also under field experience pre-approved opportunities, if you scroll down and you're looking for a program that also covers field experience, here's some great ones as well. So let's see, like AIFS, they have programs in Australia and Greece, and so I'd recommend starting to research field experience options. There's also going to be a study abroad expo in fall quarter for you to attend, and you can go around and talk to all these different programs and study abroad advisors. But to get started on study abroad researching programs, then you're going to want to complete there's a first steps training that you need to do and schedule an appointment with the Global Health study abroad advisors. So Kelly and Jim are two of the advisors you can meet with at the study abroad office. Once you've identified a program, you can bring it back to the Global Health advisors and we can talk about how this fits into your course planning. Okay, so another question is what type of careers can you do with a degree in global health? So global health is a very diverse discipline. We have students who are going into the health route, such as being a physician, an epidemiologist, clinician, pharmacy, dentistry, nurse, or PA. And we also have students who are interested more in research and policy, or being a medical officer, working with the World Health Organization, or a health advisor or educator. We also have students interested in medical research or program management. They want to get into working in hospitals or in working, with a local organization on refugee health and running those programs and developing those programs. Human resources, like I said, working with community organizations or working in public policy or government agencies. We also have students going into law, health-related law, or working with disaster relief organizations, and then also community health workers. We have a global health career page for you to explore. So if you go to undergraduate program, careers, we have many resources on here for you to get a better idea about, global health employers and resources if you're looking for fellowships and post-grad opportunities, or you want to know more about the professional organizations in global health, such as the World Health Organization or Global Health Doctors Without Borders or Global Health Council. So this is a page I'd really recommend that you explore. And we'll have events throughout the year, and the student organization will also have opportunities for you to learn more about careers in global health as well. And of course, in your classes, you'll learn more. Just a couple quick notes on where our alumni are going. So we're having students going into, obviously medical school and PA programs, nursing programs, but there's also students going into Masters of Science in Global Health, Masters of Public Health. We have students going into medical anthropology programs, going on to their PhDs, getting a Masters in Health Policy and Law, students going into the Peace Corps, and then of course we have students going directly into careers. But do note that there are many careers in global health that do require an advanced degree. So keep your options open and really do some research. And you don't need to know right now what you want to do after UCSD. That's part of the journey here, is that you're here to explore what your interests are, and you're going to learn so much in your classes that it's going to open new doors for you. So, tips for success. College Smart says, get involved on campus. It can increase your job options after graduation. So, utilize Career Center resources. They have Handshake to find internships, set up advising with career services, and other online resources for career development. They have career assessment and exploration tools, interview prep tools, and they also host workshops on your resume and practicing for interviews and career options. And HealthBeat, which is the pre-health advisors, they also run their own additional events, which you will be sure to hear about as well. Next tip is to be active in your major. You will get so much more out of it. So we have quite a few events for you to be active in. So every quarter we host quarterly conversations in global health, and this is really one of our big community global health events where you can come learn about topics in global health and really socialize with your global health peers. So the topic for fall quarter is going to be global health and technology. And the topic in winter is going to focus on humanitarian aid this year. And we've sent out polls to students to see what you guys care about. And then we work with the Students for Global Health, the student org, and develop these events. So make sure that you are responding to these polls, and there will be different topics every quarter, every year. We also have the Horizons of Global Health Research Symposium, which you've heard about. We'll have a big keynote speaker on a topic in global health. There'll be a research session, poster session, so you'll come to that and see what type of research your peers are doing. We do a field experience expo as well, where you can come learn about different opportunities for your field experience. This year we're doing something a little bit different, and you'll hear about this in the first newsletter, is we're doing an NGO and internship fair in fall quarter instead. And we've invited local community organizations to come table and tell you about ways you can get involved with that. So make sure to attend that, and that'll be in early October. We also have other global health related campus events, such as career panels and workshops, speaker series, awareness campaigns. So make sure you're checking your email, and if you do use social media, Facebook's a great way, because sometimes we share things on Facebook and social media that we don't always send out in an email to you. So Christelle's an alumni, and she recommends joining this global health student org, talk to professors and TAs about what they're passionate about in global health. Everyone is extremely knowledgeable and happy to help you learn and develop your own global health interests. Get curious and take initiative. Get an early start on planning your field experience so that you can fundraise and apply for financial aid. The sooner you do this, the better. You've heard a little bit about the Students for Global Health. This is our Global Health Student Org, and I highly recommend you get involved with them. So they have 3 quarterly meetings. They help run the quarterly conversations in global health. They do awareness campaigns, and it's really just a place that you can come and be with like-minded people and share your passions in global health and network, and really kind of get those resources and get involved in causes that you care about. It's really important at such a big university to kind of find a group that you can connect with and that will keep you passionate. So for our social media, you'll get the most up-to-date information on global health events. You'll be able to read blog posts on field experience, find study abroad. So for our Facebook page here, so it's UC San Diego Global Health Program. So all these links are also in all of our emails and on the front page of the Global Health website. So you'll see here that, okay, let's take a little, so we posted about the orientation here, job opportunities for San Diego Youth Services, posted about upcoming events and whatnot. Then we also have the Global Health Field Experience page. So if you're looking for field experience or study abroad, this is where we'll post some like random information about scholarships for certain study abroad programs. And it's taking its time to load here. But this is a place where you'll want to check out as well. So make sure you're following both of those. And then the students for Global Health also have their own Facebook page as well, and they share their own set of unique information. So I'd follow those. And then our blog is where we post. We have faculty spotlights, we have previous event recaps, field experience spotlights. So you can see Professor Judge King, he's teaching courses in fall. We share other field experience opportunities. Professor Tim Mackey, who's teaching Global Health Policy course. So I see right now we have one question that says, how do we sign up for the Global Health newsletter? You're already signed up. If you're a Global Health major, you will receive it. So just make sure you're checking your email. So thanks for asking. And we also have a Global Health Undergraduate Student Advisory Committee. And we call these our Global Health reps or GHP reps. We have bagels and office hours events and ways for you to connect with them throughout the year. They usually develop a peer mentor program that you can be a part of. Again, you'll hear about in the newsletter. So make sure to utilize them as a resource as well. You'll get more information about that. And then if you're interested in contacting them on the Global Health webpage, if you go to, okay, the internet is slowing down. Okay, so if you go to Contact Us, Student Advisory Committee, you can see the Global Health reps, and they're here for you to reach out. So if you have a question, maybe you are interested. So Courtney did the SHA Student Health Advocates Program. You have a question about that, you can email Courtney by clicking on her name here, and then it will give you her email. So utilize that. Also talking to faculty. Serena, who's an alumni at Johns Hopkins now, says don't be afraid to talk to your professors about class, their careers, anything you want. They'll give you great advice and even opportunities. And another good tip is to take care of yourself. So you're coming from a different environment, and UCSD can sometimes be very, it's definitely a change of pace, and sometimes teams just, you'll feel overwhelmed being in such a large campus. So it's really important to stay connected and stay true to who you are. So remember what your purpose is and why you came to UCSD in the first place, and find meaningful work within your major. That's going to help you feel connected. If something isn't working for you, change it. And remember that you don't need to have it all figured out yet. So I know a lot of you feel pressure because your parents or others are asking, what are you doing next? You're majoring in global health. What are you going to do? What medical school are you going to apply to? You're on a journey and you don't need to know it all yet. So just remember that you're collecting information, you're finding out who you are and what your real passions are. Then, just tell them that you're on your journey. Set small, attainable goals. So don't overwhelm yourself. Go day by day, week by week, and advocate for yourself. If you're struggling, get help. We're all here to help you. Your peers are here to help you. There's UCSD resources that you can take advantage of. There's counseling services so it's called CAPS. If you're struggling with your writing, there's Oasis. And then your teachers, your TAs, there's office hours for extra help in your courses. You can reach out to other students, and you can come talk to your advisors. Overall, just remember to take care of yourself, and don't forget that the beach is just right down the street. So if you need to go and have a Zen moment and watch the waves crashing, make sure you take the time to do that for yourself, and take advantage of this beautiful environment that we're in here. So there's a resources page on the website, so we'll have a link to that in this presentation as well, so that you can find out about all the different resource centers for you, and I hope that you will take advantage of those. Okay, so that concludes the overall presentation.